Hi everyone, welcome to our 42nd video session. We are joined here by members based around the world, and we're here to talk a little bit about mother's mental well-being and maternal health awareness. Especially, we have Maternal Health Awareness Week this week, so we're really excited to hear from the presenters who have experience in this particular topic. Before we begin, let's introduce what we do at Impaction and a little bit about our video sessions. So what we do at Impaction is to make it quote unquote easy to make a difference in the social impact space by ultimately bringing people together around the world and collaborating on resources and topics together so we can brainstorm as a community. And that's the purpose of our video sessions, where we speak to people face to face on Skype every other Sunday. So thank you for joining us today. Before we begin, let's hear a little bit about people on this call. I'm going to ask everyone to introduce themselves in 2 sentences or less. And Anvita, I'm going to introduce you last. So I'll start. I'm Shivani. I'm one of the co-founders of Impaction. I'm based in Chicago, Illinois, and I also work in education. Dan, do you want to go next?
Yeah, hi, I'm Dan Heiniger. I'm based here in Chicago as well. I'm new to Impaction. I'm doing the community outreach and engagement.
Thank you. Carlos, do you want to go?
Hi, my name is Carlos Vela. I'm a mentor at Mount Sinai Hospital, and it's good to be here.
Thank you. I'm going to ask Roger to go next.
I'm Roger. I'm from Boston, founder of IdeaTrek. We work with companies stuck in the black box for equity only.
Great, thank you. Poornima, do you want to go?
Hi, I'm Poornima Mahindru. I'm working as a clinical psychologist and perinatal mental health fellow in the Green Oak Initiative in Bangalore, India. So I'm working under Dr. Ashlesha Bagadia.
Great, thank you. Dr. Ashlesha, do you want to go?
Hi, I'm Ashlesha Bagadia. I'm a psychiatrist and I specialize in working with in the perinatal area. So I work with mothers and families dealing with mental health issues in pregnancy and postpartum. And we have a community mental health center in Bangalore, India. It's called the Green Oak Initiative.
Great, thank you. Today we'll be hearing from Anvita Nair, Poornima, and Dr. Ashlesha on an overlooked topic, which is mother's mental well-being. On an average, as many as 1 in 5 women experience some type of perinatal mood and anxiety disorder worldwide, with more than 50% of these cases going undiagnosed. The need for awareness on mental well-being around the most crucial years of a mother's life is paramount. After reading appalling stories of mothers around the world, Anvita collaborated with the Green Oak Initiative, a community mental health center, to start a campaign to survey the status of maternal mental health in India. And Anvita, I'm going to let you take the lead. If you want to introduce yourself and then go right into the presentation, that would be great.
Hi, I'm Anvita. As Shivani said, I'm the curator of the Beat the Blues campaign for maternal mental health, and I'm also an engineering student with a passion for psychology. So I'm just going to go right into the presentation. So we're calling the campaign Beat the Blues. I'll start off with the inspiration behind the campaign. So in 2017, when I was 18 years old, I lost my best friend to suicide. And right after I was diagnosed with mild atypical depression myself, I spent 4 months at home before I found out why my best friend had done it. During that course, I was also physically ill, so I was at home at the time, and I had a lot of time to myself. So I spent that time researching about different mental disorders. As I said, I've always had a passion for psychology, but losing my best friend Pragna, it gave me purpose, and I knew I wanted to do something. Going through depression myself, I went to some really dark places that I knew for a fact that I did not want to see anyone else in. And I knew that it was something that I wanted to make sure that at least one other person in the world would not go through because of me. So I started researching about all these mental disorders. And then slowly I found my focus shifting to maternal mental health. I guess it was just the idea that, a mother can harbor ill feelings towards her child. I read all these stories about how having like a mother doesn't feel attached to her baby. She loses the urge to breastfeed. She doesn't want to. It can go from anywhere between just mild postpartum blues, where you're not feeling like yourself, you're not feeling okay in the initial few days right after the birth. And then it can go to the other extreme where you want to kill yourself or your baby. And that went against everything I knew about motherhood, because that's the most important, meaningful bond that we'll all have for our lives. So that's when I decided that this was an area that I wanted to focus on, and I started researching more deeply into that. So the problem, as Shivani already mentioned, 20% women experience some type of PMADs, that is perinatal mood and anxiety disorders. And this is on average. More than 50% of these in India don't get diagnosed. The worldwide statistics are 1 in 7 women, only 1 in 7 women get diagnosed. That's because the amount of awareness is so minimal that people don't have it in them to, go out and fetch help. And the biggest issue with maternal depression is that you're not just losing out on the mother's future, the baby is also going to get affected. I think Dr. Ashlesha and Poornima can pitch in and tell us a little more about what happens to the baby if the mother is depressed.
Thank you, Anvita. So I might just say a few things about the impact on the baby. It actually starts even before the baby is born. So we have now irrefutable evidence to say that if the mother is anxious, depressed, or even just stressed during pregnancy, her stress hormones go up, and that actually has an impact on the baby's growth, and the baby can become more sensitive to stress in later life. So it starts off getting exposed to this even during pregnancy. And of course, postnatally, when the mother is depressed or anxious, her ability to bond with the baby gets affected. And even what Anvita was saying, that mothers having these harboring thoughts about not being able to bond with the baby is not something that they are comfortable with themselves. So this is something that they struggle with as much as, so they're suffering from it as much as they're thinking of these things. So it has a huge impact on the baby's growth, the baby's ability to attach itself, also its development. So it's actually the start of where we know that a lot of risk factors for later mental health problems start in the pregnancy and the postnatal period. I don't know if Poornima, you want to add something else?
I'll go with whatever Dr. Ashlesha just mentioned, and I think it's an area where exactly which is not talked about a lot, but then it has a lot of effects, what Amrita was telling about baby blues. It's actually just the prevalence of baby blues is itself around 80%, and it's common. But then when it takes a shape of anxiety disorder or depression, that we have to keep an eye for. And in terms of developmental also, it doesn't only impact a child's social development, but it also impacts the cognitive development. So both the maternal mental health and the infant mental health has to be taken care of.
So another interesting thing that I wanted to add, as Poornima was saying, that 80% prevalence rates of baby blues. This one time I was researching about, postpartum depression, and my screen was filled with different tabs. My mom walked into the room and she saw the words postpartum depression, and she went, I think I had that too. And I was like, what do you mean you think? And she said, I don't know what it was, but when I gave birth to your elder sister, the few days after, I was not okay. I don't know how to describe it because there was no one to tell me what I was going through, and I didn't really reach out to anyone either. And thankfully, it went away soon, so I didn't have to do anything about it. But right after my first birth, I just knew that I was not okay. And that was another, it was a sort of validation to know that this is a big problem that exists to various degrees. And women are going through it on a daily basis without even knowing what they're going through. So just getting the word out there and telling them, giving them a name to what it is that they're going through will make, half the journey before you approach people and get help. Just knowing that what you're going through is not normal and it's okay, and that there are other people in the world going through the same thing, that will make them feel better, and that will give them the courage to take the next step. That is the basis for the campaign. So the big idea that I came up with was to conduct mandatory screenings across all Indian hospitals for perinatal mental disorders. Now, I came across these screening tools called different. There are lots of screening tools, but there was one in particular called the Edinburgh Postnatal Depression Scale. These tools are basically questionnaires where they ask you a bunch of questions about how you're feeling and things like that. And based on your score at the end of it, they can classify you as depressed or anxious or whatever it is. The idea was actually based on those tools, to implement those tools and use them to conduct these screenings. But since I don't have medical education or any background in psychology, I knew that I have to make sure that this is okay before going forward with it. So that's where I came to a standstill, because I knew before I went further, I needed to get it validated by a professional first. And that's where the collaboration came in. So I actually called Dr. Ashlesha on an impulse. I found her number from a maternity hospital that she was working at, and I called her on an impulse. I have to say, this was my first call with respect to this campaign. I was expecting, months of trying, calling different people and, getting rejected, not finding the right people. But I have to say, calling her was one of the best things that's happened this year, because I found the right person in that first call. I called her and I told her about the idea, and she was on board immediately. So a little bit about the Green Oak Initiative. Dr. Ashlesha, do you want to tell us how you started out?
One of the things that is lacking in India is a community approach to mental health. And so we are a group of clinicians who've come together to work more in the community and have more community-related approaches. We have a neuropsychologist who has been running a very successful campaign for people with dementia, where she runs cognitive enrichment program. So she gets people with dementia together with volunteers, and they actually do programs together in the community. So her kind of ideas match with ours. We have psychologists like Poornima, we have therapists. So we basically are trying to say that mental health needs to be in the community spaces rather than in institutional spaces. Not to say that there isn't, a requirement for that, but more of the community mental health approach needs to happen. Our main focus is therapy and medication only if required. So we have a couple of psychiatrists, we have a few psychologists and therapists, and we do a lot of community events. So we have like a bi-monthly book club where we talk about, it's open for the public, where we talk about mental health through books. And we have a movie club where we kind of screen movies that have a focus on mental health, basically to use different media to improve conversations around mental health in the community. Because, from our end, there was also an understanding that as mental health professionals, we may also be very limited in the way we speak about mental health. And we also need to widen the language. We need to be talking to people and see how they would like to be having conversations around mental health. We are based in a kind of a small community charitable hospital, but we have our own space in that. And one of the things that we are very new ourselves in this community center, so it's been just a year. And one of the things that we are working towards is to improve awareness around maternal mental health and seeing what more can be done around maternal mental health. Anvita, back to you.
So I met with her and she brought Poornima on board. We decided that we would start this campaign to first survey and then come up with ways that we can bring about policy change with respect to the status and treatment of mental health in hospitals across India. And that brings us to the solution. So we decided to split the campaign into phases to, break it down and make it easier to change our direction when required. So we're in phase 1 right now. We just started out about last month, where we made this survey to collect responses from urban mothers. We decided we'd leave rural for later. And we wanted to first, get the conversation started, make them aware that there are people who are working in this field. And we wanted to understand what it is that they think about maternal depression. Because we realized that before we, go approach hospitals and ask them for different policy changes or guidelines or anything like that, we need to make sure that the people that they're catering to, their patients, their customers, essentially, they know that this is a problem. Anyone going and asking them for any kind of policy change, they're not going to listen until they have pressure from their customers. And so the women need to know that this is an issue for them to start reacting on it. So we decided to send this survey out with a bunch of non-intrusive questions, basically to get to know the mothers that we're dealing with and ask them about their opinions on maternal health. And that was phase 1, which we're still going in right now. And phase 2 is based on the results that we have on the survey, we'll change our course of action. We'll, depending on them. We were planning to publish a study based on the results, and then also we'll know better which way to go. Should it be a screening tool? Should it be something else? We can decide based on those results. And then phase 3 is finally based on the results of phase 2. We can decide on which authorities to approach with what guidelines, and then do the entire process again with a different approach for the rural population. So far, as I said, we just started when India had gone into lockdown, so we haven't been able to do that much. We sent a survey. I think it had about 15 to 17 questions. Only 2 questions were directly related to mental health, because this was the purpose of this was just to get the conversation started. As I said, this is what 2 of those questions look like. The first question was, during your pregnancy, did your obstetrician or gynecologist ever ask you about your mental health? As you can see, the results are right there. We have 63.5% women saying no. And this is an alarming number, because these women visit the same doctor for 9 months of their pregnancy and for some time after. And not once in all those visits have they been asked about their mental health. It is important, as Dr. Ashlesha said, for other healthcare workers to start these conversations about mental health, because there is no way that a woman will find her own way to a psychiatrist unless these people who she's meeting on a regular basis tell her that it's required. If the gynecologists or obstetricians are not telling you that, listen, this may be a problem, then they won't even be aware that this is something that they need to get help for. That's why the onus is kind of on those healthcare workers that these women are visiting regularly, to be asked. It's not even about conducting a test or having like a sit down interview where you ask many questions. It's about just asking, making sure that the mom is doing okay, because these things start during the pregnancy itself. And if she's not doing okay, and it's something that can be controlled before the baby is born, then why give up that chance? So this is what we got from the first question. And the second question was, do you think doctors or healthcare professionals should ask pregnant women or new mothers about their mental health? This was for building our case. As I said, when we're going to be approaching hospitals, we need to make sure that we have something to tell them that this is not just a problem that we think exists, your customers think it exists too. And as you can see, more than 85% women think it should be talked about, which is exactly what we wanted. This is the course that we wanted to take. And so this is, we're going to keep going with the survey. We're going to reach out to as many women as possible and make sure that once we've got enough responses, then we move on to phase 2. We believe that early intervention is key to ensuring a healthy life, not just for the mother, but for the baby as well. With this campaign, our missions and visions are very simple. The mission is just to first build awareness, because we believe that it needs to start with the community first. The women need to know where to go. We need to get them started on that conversation. The vision for the future is to improve the treatment of maternal mental health at a national scale. And the value that this entire campaign is based on is very simplistic. It's just that every moment counts. Every moment after the birth of the baby, all those small things about, even the milestones come later. Just forming that bond with your baby and treasuring every moment that you have together will go a long way in how the baby's life develops. Not just neurologically or all the other things that Poornima said, but even the memories that it'll have, even the values that it'll take forward in building its own bonds in the future. All of that counts in those formative years and months right after the birth. And so we believe that saving women from the grasp of depression and other disorders will help make sure that every one of those moments is cherished for the rest of their lives.
Great. Thank you so much, all 3 of you. That was very informative. I wanted to start off the questioning. Can you speak a little bit about, the women that you surveyed and a little bit about their demographics and just more information about them?
So we collected data on, how old they were, what the ages of the children were, whether this was their first pregnancy, what order of pregnancy.
Yeah, so just to add to what Dr. Ashlesha said, so we actually targeted both pregnant women and new mothers. So the mothers who were approached had infants below 2 years. So those were our target population, and it was done via social platforms or like snowballing effect through our known people. So because as Anvita pointed out, because of the limited resources because of the lockdown, so we couldn't approach a lot of people. So it's still work in progress.
These were the questions that were asked. We asked them what is their age in years. So as you can see, we have women between 24 to 45 years of age answering that question, spread out the course. And we made this specific to perinatal women only. So that means that the period from conception till 2 years post-birth. So the 9 months of pregnancy plus 2 years after is what is called the perinatal period. And this survey was exclusively meant for these women. We've asked them, since this was the urban population, the levels of education are mostly high. As you can see, most of them have completed a postgraduate education. There isn't much diversity in the marital status either. All of them were married women. And then, yeah, the rest of the questions are basically about what kind of hospitals they visited and things like that. We also have a lot of variation in the ages of the babies of these mothers. And then another important question was, do you have any help in taking care of you and your baby? Which is one of the biggest causes of maternal depression. Not having the right amount of support, emotional and otherwise. If your family isn't there for you, if you feel like you need to take the brunt of taking care of yourself and the baby at the same time, it gets a lot. It's too much to take for one person. Over here, most women have said that they have a lot of help, but as you can see, there's also 20% saying no, I don't have any help, which again is a staggering number. I don't know about this. Dr. Ashlesha, can you just pitch in and confirm? Is there any connection to having this as your first delivery and being more likely to be exposed to some sort of mental disorder?
Yeah, so there are two ways to look at it. One is that if a woman is going to develop any kind of mental health problem, if she has any predisposing risk, the most vulnerable time is in her postnatal period. But even during pregnancy, so the perinatal period is the most vulnerable time. A lot of women are more likely to experience something in their first pregnancy. But having said that, if they've had some difficulties which is not addressed in the first pregnancy, or if they had postnatal depression, then they are more likely to also then experience a perinatal illness during their second time, right? So sometimes mothers then get help. If they get help, then their chances of developing a disorder or being able to face it changes in the second pregnancy. And it also depends on the environmental stressors. So if there are financial stressors, or if they don't have enough support, if the first child is very young and they have to look after both manage both, then they have higher risks in the second pregnancy. But we do see a lot of mothers present in the first pregnancy with difficulties. Also, if you go back, Anvita, the things that were also striking is that a lot of these women had more premature, more full-term kind of deliveries. But the preterm ones are also ones that more likely to have stressors, and they are the ones that don't often get picked up, or they end up having postnatal difficulties. We also asked, about the gender, because sometimes that can be a stress factor in India, the gender of the baby and the desire that other people have in the family of what gender should the baby be. When we ask about education, I think it's quite striking that our study is still quite biased because we've only captured a very small target of the population. But knowing that all these were highly educated, and we didn't ask this question, but their mental health needs were not addressed, or they were not asked about mental health during their pregnancy. So we are not even sure what it would be like in the population where education is less, where access to health services is less, where there isn't sufficient awareness. And maybe at a later time, I'd also like to mention, I don't think this is only a problem of obstetricians not just asking or not wanting to ask. It's also the burden of the workload on them not having enough time, the way their work is structured, that they are dealing with a lot of risk in a short span of time. So they just have to get on with their work. So they may not have the space to include mental health in their regular clinical work.
Absolutely. That's all very critical to understand just a little bit about the context of the women that you're speaking about. And I think you had a powerful statement that you shared about mental health support needs to be in community spaces rather than institutional spaces. Can you speak to that a little bit more?
I think one of the difficulties in India is it's definitely the stigma is reducing around mental health. but it is still largely based on people actually going to get help. There is almost next to nothing where the general community spaces, conversations around mental health. So I had my delivery in another country, in Australia, where I delivered my daughter, and I had more than one person, not just the obstetrician, but the midwife and a nurse, and more than one person asking me about my well-being, emotional well-being. There was a health visitor who came home after I delivered, and she had like a set of questions. So there were things happening in the community. When I would go to weigh my baby in a community center, or when I went for immunization, people are asking about my well-being. So every space I encountered, there was a mothers group in the community. There were lots of mothers groups, and everyone was kind of looking out for each other's emotional well-being. It's not happening in the community spaces in India. Also, the difficult part is that actually there are institutions which are doing really good work. So we have a very premier institution in Bangalore called NIMHANS, which has the only perinatal mental health department. They have the only ward that actually admits mothers and babies together, like mother and baby unit for mental health difficulties. But and they're doing like stellar work, but the stigma attached to the institution, oh, you go to NIMHANS only if you're mad, which is so sad, because that is another problem. People don't realize that they need to actually seek help. That if they go to seek help, it's not going to be all bad. So there needs to be institutions, but there needs to also be reduction in stigma, so that even if people do not want to go to big institutions, that they should be able to access help in their area.
Absolutely, thank you. I'm going to open it up to the community. Does anyone have any? Yeah, go for it, Roger.
The data set that you're producing right now, I can see it going three ways, and I'm curious about which way you're trying to push it first. So the first way I can think about seeing it is it's a scientific data set that you're going to bring to practitioners who are then going to hopefully be more mindful when they're speaking with mothers that come into their clinic. That's one. Another one is you can take this data set to the state and say, hey, give us some money so that we can address these issues, set up programs, etc. And the third way to do it is to this might be the one that you go for, is to build some kind of application or interactive experience for people that are just straight into the communities. Ultimately you'll want to obviously hit all three, but I'm curious about which one of those three would be like your first shot, if you could just kind of reflect on what the strategy is to get use out of the data set.
In my opinion, it would be the obstetricians that we would reach out to first, but along with the obstetricians, it would be the rest of the community as well. I think the app that you talked about would be one of the ways, but in different ways to reach out to the community, that this is what mothers are saying, and these are people in your community that are saying this, and what could be different ways in which we could engage you. Because I think the other problem that we face is, when I work in hospital, I have an obstetrician who's very bought into this idea, very keen to promote mental health. So she might tell her pregnant patient, please go and see this counselor, psychologist, psychiatrist, whatever. But the number of steps it takes for her to reach me, there are so many barriers. The nurse, the husband, the mother-in-law, the mom, they're not bought into this idea. So the milieu around her doesn't promote what we are trying to promote. So we feel like we need to enable that to happen. Everyone around her should also be saying the same thing. Yes, it's important. Your emotional health is important. Only then will, even a well-informed obstetrician or a well-informed mental health professional will only be able to do something if they reach out. And we also want to kind of say that it's not necessary that they only reach out to a psychiatrist. There are different ways in which help can be sought, and that is another message. So I would say the first step would be a parallel clinician, obstetrician, and community promotion of this. And only then we might be able to do something with relation to government. There are certain things happening in the government sector, but you can imagine the problem that India faces is how vast it is. And there are so many pockets of sporadic things that happen that don't necessarily merge together, or they don't come together as a collective idea. And often for a government which are well-meaning, administrators or organizations which are well-meaning, they get bogged down with other issues which become a priority. So let's say, let's look at maternal mortality. That's a priority now. Let's look at the access to basic medical care. That's a priority. We can worry about mental health later. So I think we compete with a lot of other priorities which seem like an emergency and more important to handle. And those are the barriers that we face at a government level, which, I think that would be the next phase. But I think it's great for us to think in those terms also. So thank you for that.
For following up, the challenges are crazy, and I guess the essence of the question is more kind of, I guess, from a funding perspective. If you go to the government, right, they write you a check if you can get through all that red tape. If you go to the community, you've got to go through a kind of venture capital sourcing or some kind of private funding model. And if you go through the practitioners, you can sell them a service, right? You can say, hey, we've got this great data platform. Figure some way that you can help their practice out, either something like that. Maybe it's not at that point where you need to really consider what the funding source is right now, but I imagine that will come up eventually, and you don't have to expand on it. But I would be curious to hear, like, where do you? And maybe this is a question just for India in general and the startup community out there. Which of those three do you think would be your best bet to get the most traction as quickly as possible?
Funding is a huge problem, and I think that this is where Anvita's role probably becomes a little bit bigger than ours, because what we find we are essentially, even though we are a community-based organization, we are a private group of clinicians that have come together. We offer like a fee-for-service model where if we see someone, they pay us a fee, and then that's how. We don't have any umbrella funding. But the difficulties are, if we approach people directly for funding, it's less likely to go through unless we have more activists, more people. So I feel like Anvita is where her helping us out with funding would be one of the things. And the funding need not be only for us to offer a service. The funding could be in raising awareness. The funding could be in creating more spaces like this where we could have conversations. But I think, like your idea of us actually going through the community through venture capitalists is where we might have a better option to start with, especially a community organization like ours. And we are working quite closely with the institution that I talked about. So the specialists in the institution, which has access to a lot of funding, and they are utilizing it quite well in the perinatal space. But they also have the limitations because they actually cater to they're a tertiary care center for the country. So they end up seeing a lot of very severely unwell women, which still makes up a very small population of the nation. So they get caught up with that, but they also are quite keen to collaborate and work with organizations like us. I think it's great for us to think about that also. But I think the first step in terms of obtaining funding would be with local community venture capitalists, and getting government funding would be like a, I don't know, phase 3 kind of option.
To add on to what Dr. Ashlesha said, I'm already in the works of starting my own foundation. That has been a plan from the very beginning, mostly to make sure that I sort out my other priorities first before jumping into it. But once you have a foundation and a banner backing you, it will be easier to collect revenue and other streams. People will be ready to fund. There are already mental health organizations in India, so you know what route to take. But yeah, founding something, having an organization is the first step to answer your question.
Anyone else from the community? I know I see Maribel on the call as well, but anyone else?
Thank you for your presentation. This is really awesome. I come from a background of nonprofit work, mostly direct service for youth and young adults. I have a lot of questions around what I'm trying to ask as well, but the baseline of it is, how is mental health being normalized? How are efforts being made to erase the stigma? What other types of collaborations, partnerships do you have within the community? You mentioned, like, if you have a foundation, that's a start to start raising funds and everything, right? Getting donors. So what other community-based organizations are you working with that might aid in contributing to eliminating the stigma, normalizing mental health and personal well-being as a priority, as it's okay? Because as you mentioned, it's not being talked about in the doctor's office. It's not being asked. And when that information is being presented, by the time the information is given to somebody and that individual reaches you, so many things take place. So if someone has a need and it's addressed by somebody saying, oh, go to these wonderful people, by the time they get there, they might have been talked out of it. There's fear around it because of the stigmas. There's all the stuff that's getting in the way. And I bring this up because my role for many years was modeling for younger men, like gentlemen on the call with Carlos, that it's okay as a man for me to express that I have other emotions outside of anger. Do that in like a circle, in a safe environment, where young people can come and learn and then try and take that out into the world. But at least when they come into the room, they're safe and they don't have to worry about expressing that they're afraid or worried about someone, in their lives, or and to also talk through these traumas and partnerships that we had where largely organizations that were focused on reducing violent crimes in Chicago here, and the funding that was helping us, we were tackling that issue of violence because we were instilling these ideas and things in young men who were highest risk of being perpetrators or victims, right? So the community, the partnerships, everything kind of came together for me to be in front of somebody to model and help eliminate the stigma.
So I can tell you a little bit about some of the collaborations. Collaboration sounds like a big word because we're trying to make efforts. There is an NGO that like a not-for-profit organization that has a lot of presence in the online space. It actually has a lot of information online on mental health issues. It's called White Swan Foundation, and so we give them a lot of information that they put forward in different ways, and they have a huge growing population of people that reach out to them, their online content. For maternal mental health, we are hoping to do like a 2-hour webinar with them where they're going to have people who are women who have experienced problems in the mental health, their mental health during the perinatal period. So they're going to talk about their stories. Getting people to talk about their narratives, I think, is very powerful, like you were saying. So that is something we're trying to do, get more and more people to talk about it. And we've been working with the obstetricians as well. So there are certain societies, like the Royal College of Obstetricians in other countries, we have like the Society of Obstetricians. And most of last year, we spent a lot of time in, talking to them, attending their conferences, having like a small slot where we can make presentations of mental health issues, trying to upskill them in how do they ask these questions. And working collaboratively with NIMHANS. Now some of them have kind of bought into this idea that can they prepare a module to train their obstetricians on how to ask these questions. It is very, very early stages, and we are still in a, so I've been back in India now for 5 years, and the maternity hospital that Anita was talking about, I was going there regularly for 3 years, and still, now nowhere on the board outside did it say psychiatry. All the other services are listed in most hospitals outside, but mental health is not mentioned. It's still very much a stigma. People in the general patients who would come would not know that there's a mental health professional available to them in the hospital. So I think it takes a lot of time, at least in India, to raise awareness, and we are trying different ways like this. I know there are some government tie-ups that are going on where they're trying to use technology to upskill health professionals in rural areas where they may not even have psychiatrists, never mind a specialist in perinatal. They may not even have access to a general mental health professional. So the doctors on the ground, what can be done to upskill them? So there are some programs like that, but they're all very sporadic. And this, how you described your, like all the people in the community coming together, it's something like a dream for us, but it's much harder to make it happen. There's a lot of good work going on around in India in mental health in general. And actually, it's become like a pros and cons, of course. But definitely in the space of general mental health, we've had one of the Bollywood stars have spoken up about their mental health journey and difficulties. So a few startups have actually tied up with them, and they're promoting mental health actively. There's a lot of talk about promoting mental health in schools, and the Indian Psychiatric Society also is trying to do a lot of work in this area. But the perinatal field is still a very, very small kind of space which is not talked about that much. And the awareness that actually, what Anita was saying with regards to her mother, where it came and went, that it doesn't last very long. It's a kind of time limited condition. So by the time they start realizing, okay, I should do something about it, they start recovering and they don't get help. So that's another thing that happens. And then, but it leaves damage in its wake, so it actually has consequences to mother not enjoying the time with her baby, or the baby going through a tough time bonding with the mother. So there are lots of barriers which prevent it is becoming a concentrated effort. But it's a good start with people like Anvita coming forward and saying they want to do something in this space. In fact, I've not had anyone come to me and say this before, Anvita. So it was very refreshing for me also that you wanted to do this. It's usually me going or Poornima going, and we are all kind of telling people, please take this seriously. So I would love for more people in the community to take this more seriously and reach out. And I think people like Anvita are more likely to be heard than like a professional saying, come and see me, I can help you. So I feel the community needs to be talking more about this.
Just very quickly to add on to what Dr. Ashlesha said, celebrity culture is huge in India, and when celebrities finally come and talk about their struggles, that's when people start talking about it. As she mentioned, one of the biggest celebrities here came out and said that I had depression. This was a couple of years back, and she went on to start her own foundation as well. Because of that, a lot of people got the courage to start talking about it themselves. So once we're still in the nascent stages, but once we've started advancing the campaign, we'll look for bigger collaborations and tie-ups with people like that who can start the story. First, it's important to get mothers talking, because even though now people have started talking more about mental health, again perinatal is a completely different field, and finding celebrities who've gone through that, it's an even smaller demographic. And getting in touch with them is going to take a while, but we'll get there. And yeah, hopefully we'll have collaborations like that as well in the pipeline.
Thank you all. And thank you all for an amazing presentation and bringing awareness to this very, very real challenge, not only in India, but I think it's around the world. Thank you so much, Anvita, Dr. Ashlesha, Poornima, for sharing this very important topic. For our listeners and our viewers watching this session, thank you for joining. Please do check out what Anvita and everyone there, what they're working on, what the Green Oak Initiative is working on as well. Please check out our new website at www.myimpaction.com. We're looking forward to seeing more of these amazing social innovators collaborating on our forums and our discussion boards. And please tell your friends and family to join if you think that they have something to share or would like to be a part of this as well. So thank you all for listening.